Welcome back. So we're joined now with our sexual health topic, and joining me on the sofa this afternoon is Dr. Kang and Justine. Would you like to introduce yourselves?
Hi, so we work in the Integrated Sexual Health Service covering Cheshire West and Chester.
Perfect. So yeah, a busy time for you then, I take it?
It is, yes. Throughout the pandemic it's been busy.
Perfect. Well, we've got lots of calls standing by on the line, so we're going to call one, which is Andy. Andy, what's your question? So thanks for your question there, Andy. So how would we respond to Andy's question then?
Yeah, so in terms of taking PrEP, there's two different ways. It's either on demand or what we call event-based or every day. So if you're a male, it's really important to consider how to take it, and you do have the option of event-based. However, if you're a female or trans female, you can only take it every day.
Right.
And that's just to do with the differing levels of the drugs in accordance to vaginal tissue, for example.
Yeah.
So in terms of testing, it's really important obviously to do baseline testing for this medication that we can use for HIV prevention. And we would encourage that you come to the clinic, do a full STI screening test, including HIV test, and knowing that that is negative to start with before starting treatment is really important.
And is PrEP free for everybody then, or is there a cost to this?
So in the past, the way we established the demand and need for PrEP was under something called the IMPACT trial. That was delivered for 3 years and ended in October of this year, and that did demonstrate it's obviously really efficacious and has benefit in terms of reducing risk of HIV transmission. And so yes, since October 2020, it's now widely available on the NHS, but through sexual health services like ourselves.
And is that across the whole of the United Kingdom?
It is, yeah.
So that's really good. I suppose it's a really powerful tool now in combating the fight against HIV now.
Absolutely. And there are a few sort of, not side effects, but things that we would screen for as baseline that's really important. So we just check kidney function, which is done on a blood test once a year.
Right.
And at every visit, which we would encourage is every 3 months, we obviously repeat the full STI screening, HIV test, syphilis test, and chlamydia and gonorrhea testing according to sites. And that's how we decide, obviously, for future prescriptions. So every 3 months, we would do a 3-month prescription of PrEP. But in that time, it's obviously really important to be thinking about condom use, talking about HIV testing with partners or when there's a change of partner. And it's just looking at the whole picture, not just sort of PrEP in isolation. That's really important.
Perfect. Well, Andy, I hope that answers your question. Thank you very much for that question. It's really informative response, and I hope that does give you the answers that you need. We're going over to Jack now. Jack, what's your question, please? So would we say it's recommended if they're together under 3 months and new? And
Yeah, okay, thanks, Jack. First of all, it's great that you're thinking about testing for sexually transmitted infections, and that both you and your partner have been already tested. But if we can just mention the window periods. The window period is the time that it takes for a sexually transmitted infection to show up on the testing. So if we think about chlamydia and gonorrhea, that takes 2 weeks to show up from the sexual contact, and HIV takes 45 days to show up on the testing kit, and syphilis takes 3 months to show up.
So there's a big difference there in timescales. So constant testing, I guess, is key, and as they've said from day one, they've tested before they're in a new relationship. I'm guessing, the honeymoon period, if you like, they're going to be more productive in the bedroom, I guess. So I suppose testing in that sense is key then. Yeah.
So for Jack and his partner, then we probably thinking about retesting at the 3-month period, and then if there's any new risks, then you need to consider those risks and consider the window periods and when you think you're going to need to retest.
Cool. So thank you very much for that. We'll put all the details on the website chesterpride.co.uk. Our next call is on the line now, and that's Tim from Chester. Tim, what is your question, please?
Completely understand that it's it can be embarrassing, but this is actually what we do. So it's really important you come in to have an examination and a discussion to try and find out what the underlying cause is. I've actually got a penis model here, which I thought might be a little bit helpful in sort of demonstrating what might be the cause here. So from what he's described, there's 2 different possible problems here. So the first is a tightening of the foreskin. So not everybody has a foreskin, but it's the area that's just around what we call the glans penis here, covering that. So, in terms of the tightening, that the technical term for that is called phimosis. And if phimosis occurs, what we say, in a very short period of time, and it becomes painful or swollen, and you're unable to retract and put the foreskin back, that's an emergency, and would want you to obviously contact us urgently for review, or you can go to A&E, and that's what we call paraphimosis, and there can be complications to do with the blood flow being restricted. So if, however, it's more of a chronic problem, so sort of you've noticed a change and you can't quite retract the foreskin, there's either pain or there's redness, sometimes even discharge can collect at the bottom, even with urine trapping, that can then cause a cycle of either inflammation or infection. And then the kind of white dotted areas that was mentioned, or the redness, I think you said, with the spots, that can sometimes be an indication of an infection. So it's really important that we obviously do that assessment and try and figure out what it is exactly that's causing that. If it's an infection, there are either causes such as fungal infections or bacterial infections, for which we have creams or even oral treatments. Sometimes it's about talking about skin hygiene, which we'll go through in a bit of detail as well. Or sometimes it even can be an STI. So it's really important to come in, have that discussion, have the testing done, so we can find out what the underlying cause is. Certain things that we talk about with hygiene that I think is really important is about sort of washing under the foreskin. So what we recommend is on a daily basis in the shower, when with warm water, to try and fully retract the foreskin, clean under the area, even using something as a soap substitute, something like aqueous cream that's not irritating towards the skin, can actually help sort of with that. It's really important not to use perfumed products or even shower gels or bubble baths, for example, because they can actually make things worse.
As I would imagine, they'll irritate the skin, because it's a sensitive area anyway.
Yeah, and if there's an existing problem there, we don't want to obviously add to that or make things worse. But having said all that, even though we are a sexual health clinic, sometimes there can be things like dermatological conditions that can cause things like this. So again, really important to come in for a review so we can see if there's anything else going on. For example, eczema, certain conditions like lichen sclerosis or planus, but to make that kind of full assessment is only possible by coming in.
And I suppose from that, in the first instance, that it's not so much necessarily it's going to be a surgical operation to treat this. It could be, like you say, through creams or tablets and stuff. So it's not things to, to think, oh God, I've got to have an operation to treat this. It can be treated potentially from obviously the diagnosis is key to determine where you go with that, really.
Absolutely. So something like a circumcision, which is obviously removal of the actual foreskin, is something we would only consider as a last resort.
Right.
Quite often there's something underlying that's causing the issue, and that's what we need to do with those various steps that we said, and things like creams or tablet treatments, and treating the underlying cause tends to resolve the majority of these. So really, really glad that you've asked the question, and please get the confidence to come and see us. We're very experienced in this area, and
I was just thinking that, I mean, for anyone at home to phone up for anything sexual health, it's one of those things we don't talk about it. For yourselves, this is what you do day in. I suppose it's like going to a sweet shop and asking what's the most popular sweet. They just, someone in the sweet shop will just go, oh, it's that one. For you, it's, oh, we've seen that before. We'll deal with it. We'll get on with it. And I suppose it's that confidence to just approach yourselves first. And once you've got over that initial fear, everything's fine then. And you go to the right place, I guess. It's the best thing to do, because if they were to leave this, I'm guessing it could potentially worsen and then go down a route of, a different approach, I guess, if it's too late.
Definitely, that's one of the things. Unfortunately, sometimes we do see patients with a number of years that have coped with this, and there are psychological impacts of that. So, problems with pain or problems during sexual contact, and it's just having a knock-on effect, which is really important. Come and see us early so we can try and obviously come up with a plan. I think it's really important.
Perfect. So there you go, Ian. Get yourself to the clinic, and the lovely people there will help you out. Thank you very much for your call. I'm sure that's probably one of these questions that we weren't expecting to hear on stage. It's quite a personal question, but I think it's key these questions that are coming through are touching on a wide range of subjects, and nothing is, for us now talking about, it's not an embarrassed subject to talk about. This is your daily thing. For anyone at home, they might think, oh, I didn't think that, and this may open doors now to other people to think, actually, I've got something similar, I need to get in contact, I guess. So, okay, so our next question is coming from Liam. Now, Liam, what's your question, please? So that's a good question, because I was under the impression that age is different for testing, but I think I'm misinformed in this one, and I'm glad this has been asked, because this is something I'm going to learn today as well. So how would we respond to Liam as a 35-year-old male?
Yeah, so the age isn't so much of a concern, but you can obtain the testing kits, you can order a kit online straight to your home address, as we mentioned before,
Yeah.
or to an address of your choosing. Or you can come in and collect a kit from the service. So we would routinely we would test for chlamydia and for gonorrhea.
Right.
And the testing sites would be a urine sample. We can do a throat swab, a sample from the bottom,
Yep.
which is a self-sample swab that you would do, and a vulval vaginal sample.
Yeah.
And for HIV and for syphilis, that is the blood sample testing.
Right. And is that normally done together? So obviously, you know, it's like a full MOT, I guess. If you're coming in to be tested, you'd have everything done as standard. You wouldn't have to say, oh, I want this, I want that.
No. Routine testing is the chlamydia, the gonorrhea, the HIV and the syphilis.
Right.
So we have the testing kit boxes here.
Cool.
So if you order one, sort of you can collect the kit, or
Yeah.
you order it online. This is how it'll come in a box. And then within the kit, you have the testing. There's a little urine pot here. So once you've done your urine, into your first catch of urine into there.
And that's quite key, isn't it? It's got to be as soon as you go to the toilet, it's the first drop, I guess, of starting to go to the toilet. That's the bit that you need.
It is, most definitely. So that you've got your bit of urine into the receiver there, and then you're just going to pipette the urine out and then into the sample pot.
Right.
And there's lines on the sample pot where you need to make sure your urine goes.
Right. Because I guess that's quite key, because obviously when you think you've got, you know, you say, oh, you need to do urine sample in a tube, you think, well, how am I going to get that to the right parts to do it? So I suppose with the collection dish there, that's a lot easier to do then, because that will work for anybody then of any sort of gender, or, you know, it's an easier process, I guess.
It is. It's quite straightforward, and all the details of the sampling is in the box and in
so
the
it's like
kit.
a step-by-step guide type thing as well.
Absolutely.
And again, that packaging is quite discreet, isn't it? Which is what we said before.
Is,
so if you're worried you're going to get this bright thing saying, you know, STI test or STD test, or you know, it's not. It's quite.
It's
you
just
know,
a plain box.
Which could be something from a, you know, an online retailer with a CD or something in it, I guess.
Absolutely.
So
And then we have the swabs.
Right.
So that is just a very small swab there that we use, and once you've done your testing, you obviously open up the pot there and just pop it in, and then you can just break it off at the black line there and make sure.
And is that a throat swab, that one, as well as?
Yes,
yeah.
We use those for the throat, we use them for vaginal swabs, and we use them for the back passage.
Right. So I'm guessing with the throat swab, I'm sure most of us now are used to, obviously with COVID, we're used to putting these in our mouths and stuff, and it works the same way, I guess. It's to the back of the tongue, is it?
Absolutely.
Yeah.
You just need to go. Sometimes it can make you feel like you want to gag. But
Yeah.
you know you're in the right place if you.
Justine,
Yeah.
I was going to say nice wide sort of open and you know where your tonsils are at the back, and then you've got something called the uvula. It's just about rotating
just a good
swab at
go
the
around,
back if you can. That's ideal.
Perfect.
And then the blood sample pot. These are the little needles that you would use. So you twist that off. And then if you use the side of your finger, obviously make sure your hands are nice and clean and nice and warm, encourage the blood flow. And then if you take that off and just get a good contact with the needle, I think sometimes if you don't get a decent contact, you don't get a decent blood flow.
Yeah. Because I did one of these for HIV Awareness Week, and I was quite shocked at how easy it was to do. And again, the kit that I got was very informative, because I'd done one previously, but again, I'd done mine through a surgeon that had done it for me. Because I'm not scared of needles, but I'm not confident in using a needle myself. And I found it a really, really easy way. Probably more in my head, it was going to be a lot harder than what it was. So these kits are actually really, they're foolproof, I guess, really.
Yeah, they are quite straightforward to use, and all the information about how to take the samples is contained within the box here. So that's a little tube there that you want to put your blood sample in.
So it's not a lot of blood there, is it? You're not thinking, oh, I've got to give a pint of blood, or,
No, it's just a small amount there. And then once you've done your samples, if you pop them into the sealed bag there, and then in they go to the addressed envelope, and then they get sent off. And we're expecting to have the results back within 10 working days.
Right.
And just to note, it is 10 working days, so to take into account any
like bank holidays and weekends and stuff,
Yeah.
And I'm guessing that depends on obviously the demand of the service. It could take longer, I guess. So if you've not heard back in 10 days, it's not like, oh God, you know, what's happened. It can be longer, I guess, with things.
Yeah, but you can always, if you have any concerns about your results, or if you've not received them, you can always give us a call, and we can have a little look at that for you.
Perfect.
I think one of the most important things to mention is not to order a kit and then give it to somebody else.
Right.
Because these kits are assigned to each individual who requests them, and that would cause an awful lot of confusion with results.
Yeah.
Because the results would obviously come back in your name, and it was somebody else's.
And that's quite key, because I didn't realise that. I thought, you know, I thought you just literally had the packs ready in the envelope and off it goes to Mr. Jones or Mr. Smith or whoever is on it. But I suppose if it's tailored to them, and then obviously I suppose that helps in keeping a progression and track of what they've done then.
Yeah.
Are the test kits free as well?
They are all free of charge, and you can test as frequently as you need to test. Yeah.
Yeah. And what would you say is the recommended sort of testing, you know, if you were doing it on a regular basis sort of thing, is it every 3 months, every 6 months, or does it depend on activity and stuff?
Yeah, I would say at the start of a change of a new partner, and then just as Justine was mentioning before about the window periods for testing.
Right.
So once you have had a sexual exposure, it's really important to think about the window period for chlamydia and gonorrhea at 2 weeks, for HIV at 45 days, and syphilis at every 3 months. So it all depends on either if you've got symptoms or a change in partner or a new risk, remembering in the back of your mind those window periods for repeat testing.
Yeah. Perfect. And again, all these details are on the website. We'll send links over, because you actually have a really informative sort of frequent question and answers on your hub, which has got some really key questions there. So everything we've talked about today, the answers are on the website as well, or if they're not, I'm guessing that people can phone in and ask a question if they need to, or email in. So there's always that constant support there for questions. I guess we're all learning things, and you might have a follow-up question to what we've asked today. Think, actually, I want to ask that, and obviously getting in contact is a good thing, I guess, to stop the spread of anything like that. There you go. So we've got another question now, and this time this question is anonymous now, which, you know, again, is not a thing to not do. If you've got to ask the question, you've got to ask the question. So this question has been voiced by one of our actors standing in the wings today. So can we have the question, please?
My friend has asked me if I'm into chemsex. I have no idea what it is. Can you explain this?
Now, this is something I have no idea myself, and I've seen this on sort of, you know, there's things like Queer as Folk, which was back in the 90s, early noughties and things. So what is chemsex? And I mean, is it straight, is it as straightforward as that, or is it a wide range of things?
Yeah, it's a combination of things, but the actual terminology itself is using chemicals, but in the way of things like recreational drugs or party drugs, in the context of sexual contact. So it might be either in group sex or individualised sex, but it's using it either before, during, or after sexual contact in that scenario.
Yeah.
So in terms of what kind of drugs or substances can be used, there's a wide range and variety. Yeah. So from things like snorting of drugs, or injecting of drugs, or inhalation, or even
would poppers class as something like, I mean, I suppose they're now known as room overriders in certain shops now. But yeah, I mean, poppers were a thing when I was out on the scene, if you like, and it was something that I didn't get the point of them, to be honest. It's the smell alone is vile, but that would class as chemsex then.
It does. So because some of the aim of using chems, as it were, you know, through sexual contact, is to perhaps enhance the experience that's occurring to do with sexual contact. So poppers historically causes dilatation of the anus, so it's actually supposed to enhance the experience of receptive anal sex. So poppers, yes, can be classified in that way. But some of the ones that are more associated with chemsex is things like GHB, GBL, methadone, for example, or even things like cocaine or ketamine. And each drug has its own method of action. So either stimulation or relaxation. They all work in different ways. The one sort of areas, I guess there's numerous things to consider in chemsex. One of the ones to consider is things like consent, for example. So it's about being in control, consenting to what is occurring in terms of sexual contact. Another thing is condom use. We always obviously promote that. It's really important from a kind of STI perspective. And if you're disinhibited due to the effect of drugs, for example, you might not think of that, for example. So it's really important to be almost prepared if you're engaging in chemsex as to what measures you're going to take for being safe in that environment. If there's things such as injecting of drugs, obviously it's really important you come in for testing. We discuss that, and we talk about risk reduction. We talk about vaccinations for certain things. But again, in certain parties, it's about slamming packs and perhaps having coloured needles according to yourself. So you're in control of what you're using, and it's really important you're in control of that.
So that's quite key, especially if it's group sex, and obviously there's needles involved, which, you know, you'd hope people wouldn't be going down that route, but if they do, again, it's controlling you're taking responsibility yourself, I guess, like you say, coloured needles, so you know, keeping your things together on yourself. It's not just put on the middle of the table and you're, you know, diving like a pick and mix type thing.
Yeah, one I really wanted to discuss, obviously, in the context of chemsex is GBL or GHB, so it's a colourless, odourless liquid, and it can be taken in small quantities. However, it's really easy to overdose on that.
Right.
So because it's just such a small amount that's required, and you can go into something called respiratory arrest, where you basically, your breathing is so slowed down that you can actually stop breathing. So there has been cases of, you know, young people going to a chemsex party, they've ended up overdosing on that, and they've ended up in ITU. So that's something I think in those environments to be just really aware of. So if somebody is drawing you up GHB, it's understanding the measurements, and just being in control of that, because it's very easy to go overboard with it.
And I suppose that, again, in this, it's education is key. It's knowing what you're doing, what you're taking, knowing the source, I guess, as well, because as we know, you know, there's so many bad drugs out there. Or, I mean, every drug, I guess, is bad in certain contexts, but it's knowing what you've got, I guess, is the key. I mean, like you said there with GHB, it's something that I've always associated with sort of with date raping and things like that, and it's got that stigma to it. And I guess, like you said, then the dosage is very key. And, you know, I mean, if in terms of, obviously, with that, if you took too much and you know, like you said, you went into ICU, is there then, obviously, if anything, you know, was bad to happen, someone passed away from that, I suppose it then goes into like a manslaughter or murder. So, you know, you start going to different areas, and I guess, so I suppose it's really key that this dosage is, you know, is right.
Absolutely. So, you know, criminalisation in that context, it's about, you know, consent again, for what you were consenting for, but the lines can become really blurred. So if you imagine you're at a party where everybody's doing lots of kind of various drugs, about trying to keep those boundaries and having that awareness, I think is really, really important, because there can be, obviously, unfortunately, tragedies in that environment.
I mean, it's quite a scary thought that, you know, just something so small can have, you know, a massive impact on you know, on your life, really, I guess. So it's, like we said, it's education is key in that one, and doing your research, and it's something to think about. And like I say, it's opened my, you know, listen to that, it's made me shudder at the thought of it. And I just think, you know, gone are the days of, you know, what I would probably class as boring sex now in comparison to that. But I guess everyone's different, and it's finding your comfort zone and things. But yeah, that's a really interesting subject. I'm sure we'll touch on this again at some point in one of our podcasts through our website. But I'm quite glad that question's been asked, because it's something for me. It's always good to get information in, and it's something I would never consider. But it's opened me up now to people I know that do take recreational drugs, to say, actually, do you know what? There is limits and things to the body. You know, the body isn't got to absorb everything and be like, yeah, it's fine. So it's...
And it's just being mindful about, you know, having a discussion with ourselves about, you know, perhaps addiction or kind of the reliance on that, being able to even have sober sex or not, because you've got into the kind of habit of chemsex parties, or only being able to have sex when you're inebriated or on drugs, for example. So it's exploring really the reasons and kind of your your perception of what you think it is, with how you're using drugs, as it were. So if it is something problematic, we do need to talk about things like risk reduction, and there's other things that we think about, as we mentioned, with vaccinations, things like hepatitis B, hepatitis A. We even do things like Gardasil vaccines, which is for HPV, but also just talking about the relationship with drugs. I think that's really important to kind of understand, if it is a problem, what we're going to do in terms of an action plan to try and help address that.
And I suppose if someone's thinking of doing, you know, taking part in chemsex, I suppose there's no sort of bad stigma to it, to you know, to ask you, you know, I want to try this, what, you know, and getting information beforehand, as opposed to doing it and then going, oh, I did that wrong. And I suppose no one's judged if they phone or email on that certain subject, because it's one of, I mean, although a lot of recreational drugs are illegal, I suppose you wouldn't judge a person on taking an illegal drug. You judge them on the facts that they need to know, I guess.
Absolutely, and I think what you touched upon there really nicely is something called hepatitis C. So hepatitis C in kind of chemsex can be transmitted either through practices like fisting, for example, or even snorting of drugs. So if you're sharing lines and straws and you weren't aware of that risk, it's again thinking about that, and we can have those conversations. So it's, absolutely. Come and talk to us. We're a confidential service. Everything you say to us is confidential, unless it's something we're worried about with your safety or the safety of someone else, and then we might need to break confidentiality. But in terms of recreational drug use, it's not something we'd be disclosing to the GP or, you know, contacting the police. Absolutely not. So it's really important that's, you know, conveyed, that we want people to come to us and talk to us about that.
Perfect. Well, I hope that answers your question. And please, I suppose that the plea there is do your research before taking part in this. Education is key, people. So there we go. Okay, we're going to take a quick break now, and we will be back